the hearing to be. Oh, there you go.
Online.
Yeah, I
Okay,
think
this
just
is
speak a little louder than, because you don't have the mic in here, so
All
I'll
right.
close the door so it's quieter.
So, all right, today we're gonna talk about your feet and legs. So we wanna all make sure that we're able to walk. We all want to make sure we're able to get to the places we want. So, in general, today presentation is we discuss 10 major problems that you can encounter with your legs and feet. I'm gonna concentrate on a specific one with the peripheral neuropathy. It's a little bit tricky and very hard to deal with, but we do deal with that. And then we're gonna have a longer time to answer all the other questions regarding all the other problems that mentioned. If you have questions not related to the legs and feet, you let me know at the end. I will do my best to answer them. If it's something burning you need to ask before you forget it or want to know answer right now, you're welcome to interrupt. Okay, don't feel bad. Okay, keep your footing. My name is Dr. Gleb Kartsev. I'm working at Hudson Physical Therapy and Riverdale Physical Therapy. It's two sister offices. One is in this building at Suite 121. Another office is 2735 Henry Hudson Parkway in the professional building. Jerryman used to be a PT. Now we took over. He happily retired. So that's another location when you can see me and also other therapists that works with us. So common leg and feet problems, muscle strain and sprains. Somebody might have familiar like, hey, I pulled my back. So that's usually relating to pulling a muscle. So muscles, they have a good combinations of small cells, they like interlocking. And they like have a little bit of the motion. When you overstretch them, that's same as you overstretch the rubber. That's not recoiling back enough to the prior size before. So same may happen to the muscle, and it needs time to heal before it can be feeling normal. That overstretch gonna feel like you losing a control over the body. On top of it's a painful. So that's frequently happening to hamstrings. Football players, anybody playing soccer, football, tennis?
Oh,
Okay.
tennis, years ago.
So basically, I'm sure you're familiar when you pull your hamstring or something, that's gonna be the strain that you feel it. So it takes about a couple of weeks until the muscle recover if there's no damage. If you see a bruising after a strain, that's mainly it's already minor tear, possibly grade 1 tear. So commonly happens to ankles, commonly happens to calves. So that's takes several weeks, you can walk it off. But usually if it's a major one with a grade 1 tear, that already needs some medical interference and proper rehab. Fractures, everybody familiar with fractures? And if you did not sustain it, some of the close one you know did have it. So they're very common and very common for the elderly. Meanwhile, just a FYI, hold on, a little bit back. Okay, so what's happening with the fractures? When we become older, our bones have become less flexible. What did I say? Flexibility towards the bone. We all used to think that the bones are rigid. They are not. The younger we are, the more flexible we are. So for example, rib cage, if it would be rigid, I would not be able to bring it up together and squeeze it. You have to have a certain plasticity. The best analogy for that, I think, would be the tree. The younger tree who has a flexible trunk, they can withstand any storm. The older tree that's not having a flexible trunk, they will break and fall in a house. Terrible pitch. Terrible to be in that spot. So that same happens with the bone. The more plastic, the more active we are. The healthier the muscles, the healthier the bones. Everybody thinks that's usually calcium being used mainly by the bone. It is not, it's mainly by the muscles. But then the more we train the muscles, the stronger becomes bone. So there's all different types of programs in PT where you can address your osteoporosis or osteopenia that's an early stage with the physical therapy. It doesn't happen overnight, doesn't happen over the month. It's a almost 8 to 10 months program to have an exact change, but it does work. The more you're becoming better, the better your body will be, the more flexible it will be. So fractures, we know it's broken bones takes time. It's usually 4 to 6 weeks for healing, if initial bone healing, but then it takes another several months to all the soft tissue grow and heal back around the area that was fractured. Plantar fasciitis. Have anybody stood up in the morning, stepped on their feet, and felt like the nail was driven into their foot? So that's usual description of the plantar fasciitis. When you're sitting for a little bit and then you're trying to stand up, and it's like if you step on a nail. So that's a very painful. Sometimes if people like just hey passing it along and like they don't pay attention, they're not addressing it, trying it, walk it off, rubbing with the medication or just taking Advils, that thing is gonna stuck with you for a while. I usually work with the complicated cases that usually do not respond with the cortisol or steroids injections. That's your steroid injection, but it's addressable. So that's in general overall situations with the plantar fasciitis. Also very required for your shoes. So in my specialty, I always look into people's shoes, and I'm known to be criticizing everybody's shoes all the time. So if anybody need to assess their shoes, I'm here. I can tell you my honest opinion by then. Don't be upset with me. That's for your greater better. Achilles tendonitis. Everybody knows the Achilles tendon and its inflammation and the attachment of the tendon. So you might say, "Oh, I have a shoulder tendonitis or Achilles tendonitis or my gluteus tendonitis." That all talking about the inflammation happening at the place of the attachment of the muscles at the bone. That's what tendonitis means, the inflammation of the tendon. And that's usually what it's referred. It does take time to go away. It's several, about 2 to 3 months to go away if the body healthy. If you're dealing with other health conditions, it might take even longer, but achievable. Shin splints. Shin splints, it's usually common for people who walk a lot, not only soccer players and football players. Tennis players also sometimes experience shin splints. That's a sharp pain right in the front of your leg. Very good responding to the therapy, very easy. I believe probably one of the fastest to respond to the physical therapy amongst all of them noted. Bunions, ladies who likes good shoes, high heels.
Love them.
You all know what a bunion is. Okay, basically a growth at the side of the thumb. If you're lucky not to have it, you're really lucky. That's a lucky lottery because I deal with a lot of clients who had the bunion surgery. Not all of them are straightforward. So it takes time also to recover, more or less straightforward recovery, usually done when you're 40, 50. Later on in life, it's more like accommodations of the shoes. You just have to give up your high heels and get wider shoes. Cute shoes doesn't mean good shoes. Doesn't matter what age you are. You have to make sure you have properly fitted even for your good shoes. Frequently people might have, oh, I got New Balances, they're good. Not all the New Balances are equal. Not every shoes that feels comfortable are good for you, because if you have an inappropriate shoes, you might develop the guy we talked before, plantar fasciitis. And bunion as well, especially for the bunion, it's very easy assessment. If you feel like you have a tension on the sides of your feet, everybody can see it right here, that means it's too strong. You also have to have your shoes a little bit bigger than your foot, probably half a size. So by the end, when you're walking all day or sitting all day, they have a space to expand, because our feet swells up by the end of the day compared to the morning. So they have to have a space where to go. So that will prevent like excessive pressure and that inflammation starts. Hammer toes. So a deformity of the joint causing the toes to bend abnormally. So what I'm gonna have in my next slide is basically every single of these things, like, and we're gonna have a visual presentation. So also commonly happens, and also read the last part, wearing tight or narrow shoes. Especially tight, especially when you don't have a straight formation, your tendon becoming too tight and it's like not getting enough flexibility. Another thing that we heard about, the bones also need flexibility. All of that causing deformity to develop. flat feet, usually that's something that majority of people born with. But it's also addressable, or sometimes it could be developed due to trauma, to the leg trauma or nerve trauma. Nerve trauma meaning if nerve affected, it cannot engage the muscles, and that will let the arch drop. We're talking about people who has absent medial arch right over here. So if you easy test, what you can do is like step on something moist and then step on a dry floor. You're gonna see the print as the common print that you see, like it toes, a little bit cavity, and then a heel. If you see that, that's normal. If you see like one foot like a paw print, that means a flat feet. There's a severity and grades, they vary. Some of them are very responsive to the proper shoe wear, some of them not, and they need to have a custom made. Varicose vein, something frequently happens, especially with age, usually has a congenital genetic component, meaning like if you have it running in your family, sometimes you may develop much easier than others. But there's a good part that can be done. You can wear compression stocking to prevent developing. You can take care of your vessels, because also if you have a tendency to develop a poor vessels, like we're talking about arteries and veins, you might also support your body with everything that need what is good for your arteries and veins to make sure they do not degenerate as fast as they could if you take away that support. So that's something that can be addressed even if you have an initial varicose vein already. There's exercises for that to make sure that your vein flow consistent, that your vessels are supported and trained properly, because the healthier the tissue, the less degeneration happens in the tissue. And that goes through all the boards, muscle, tendons, veins, and skin as well. And we're coming down to the key of the program that I'm going to talk the most about today, peripheral neuropathy. So peripheral neuropathy, damage to the nerves that on the peripheral systems, leading to symptoms such as numbness, tingling, and pain in the legs and feet, commonly associations with the conditions like diabetes. If somebody felt or heard about stocking glove symptoms, such as what it is, it's a diminished sensation in your hands and feet. So for example, before you were able to step on some surface and it's like, oh, I feel this smooth, or I feel this is not so smooth, or a little bit sand under it. When the peripheral neuropathy happens, people losing that sensation, they might even step on a nail and not always feeling it, just see the blood on it. So that's a losing sensation, and that's actually very traumatic for multiple reasons. Not only that you might not spot a blister or see the damage or step on something sharp and hurt yourself. Also, you're losing a feedback from your feet to your brain, and your brain doesn't know if you're standing vertically, if you're standing on the incline, and that cannot respond to your body to adjust into proper bending on the knees, hips, and core. Because you need to understand, like, we think that we're getting only visual perception, like, okay, I see where I'm going and I can see it's flat, I'm gonna walk flat. But it's also, I'm gonna be able to do it just even if I'm doing it with a closed eyes. That's possible because I have that feedback from my feet. My feet tells me we are straight. My ankles tells me we are straight. My knees saying, hey, your bone's in this position, that it means, and in my brain, okay, when this bone's in this position, that means they're on the same surface, same level, and they're on a level surface. But if I'm gonna try to do it with the closed eyes on unleveled surfaces, I'm still gonna be able to do it to the extent because I'm relying on my feedback from my body, and that comes from my peripheral nerves. And that if that peripheral nerves affected by the damage and they do not send me enough signal, that's where we're starting to have the problem. Unfortunately, this, unless it's a traumatic, it takes time to develop. So you have to be very cautious. Hey, do you have good sensations? You can simply just touch your foot and like, hey, do I feel it well or not? On the both sides, do you feel it equal? Do I have a pain when I'm walking? Sometimes peripheral neuropathy could be due to nerve compression, and that's associated with a lot of pain in the feet. Meaning, People may feel like cramps in the feet when they walk. They might feel just as simply like every step might be painful. There's different variations. Could be, and it's all comes down to the point how the brain will decide, hey, I'm considered threat, and I'm gonna send the pain signal response, or I'm considering it's numb, and I just don't have enough signal from the feet, and I'm gonna ignore it, which is commonly leads to amputations for the people with diabetes. Okay, so let's see some pictures. Hamstring strain, or muscle strain, that's one of the easier like pictures to show you what happening. As I said, there's the built-in muscles, which is myosins, they've been overstretched, they did not recoil properly because of the past their stretching limit. That's gonna feel uncomfortable, muscle probably for between 2 weeks and 1.5 months, depends on the strength. Broken bones, you know it. The fractures healing for the bone itself between 4 to 6 weeks, for the older 6 to 8 weeks, probably with a cast. Frequently done surgeries, those speeds up the healing. And this is peripheral neuropathy. Also associated, when it lasting for a longer time, the nerve losing the
The myelin?
yes, the myelin sheath, and that's also sometimes like, and it's not, myelin works as an amplifier of the signal. If you don't have enough of it, it's not gonna pass the signal out to the brain. We have Achilles tendonitis, so here's the Achilles tendon, and that's where the inflammation commonly feels, and it does feel exactly at the heel. Plantar fasciitis, you see it's simple. All the itises, it's all inflammation in Latin. So you're gonna see it on the bottom of the foot over here. Hammer toes, that's if we're wearing a lot of tight shoes, narrow shoes, that's not letting you open up your toes, might tend to the spasm of small muscles, intrinsic muscles, or even tightening of a tendon when it's extended for the longer time periods. Bunion, you see the different levels, so mild, moderate, large, and severe. Sometimes it prevents people from being able to normally walk and balance, because one of our first toe is actually very important for the push off, meaning when we're going forward, that's the major propelling force that's being transferred through the big toe. Flat feet, that's more excessive. Example, sometimes it's not as big, it's completely absent arch. And we have varicose veins. That's basically the vein that shows it entangles, it's not becoming unhealthy, flared up, and it's not able to push the blood up. But as I mentioned in the beginning, today we're gonna concentrate on the peripheral neuropathy. So peripheral neuropathy happens when the nerve located outside of the brain, that's the peripheral nerves, and outside of the brain and spinal cord are damaged. This condition often causes weakness, numbness, and pain, usually in the hands and feet. Also can affect other areas and body functions, including digestion and urination. Why? Because everything that passes the brain and spinal cord, that's considered like, and goes out of it, that becomes peripheral. So that's why it's a broad term that frequently used as well. Peripheral nervous system sends information from the brain and spinal cord, also called the central nervous system, to the rest of the body throughout motor nerves. So peripheral nerves used not only to send up the response to the brain, but also receive the response from the brain. So for example, with the severe peripheral neuropathy, you might have the intention, hey, I want to lift my toe up to this extent. But since the nerve is damaged, you're just going to be able either just a little bit lifted up or not at all, depends on the extent of the damage. Peripheral neuropathy can result from traumatic injuries, as I mentioned before, infections, metabolic problem, inherited causes, and exposed to toxins. One of the most common causes of neuropathy is the diabetes. That's why I already used a couple of the examples of that. People with peripheral neuropathy usually describe the pain as stabbing, burning, tingling. Sometimes symptoms get better, especially if caused by conditions that can be treated. As I said, if it's not a severe trauma, if it's a temporary compression or compression on the nerve was released sometimes surgically, that may recover of the problem at all. Medicine can reduce pain or peripheral neuropathy. Medications right now is pretty well available and widely available different solutions. So that's something that you will need if you're experiencing similar pain to speak with your primary care physicians or neurologists. They able to prescribe you proper dosage and proper type of medications to help you with that problem. Okay, therapies. So there's multiple approaches to the therapies of the peripheral neuropathy. It's crumble therapy. The treatment uses electrical impulse to send non-pain messages to the brain. And the idea with that, it's same as with the radio. So your neighbor's playing a loud music, but you actually want to shut it up. You put your favorite one just louder. Now you're able just to listen to yours. You barely can hear the other one. Same happens with the brain scramble therapy. You introduce another signal to override the signal that's taking your attention and like causing the pain. Frequently, if you're familiar, tense units are frequently used. They exploit such a called gate effect, meaning you over-occupy the channel and you override the signal that is painful. So tense units are frequently used. Probably if you had therapies before, the chiropractors or PTs, it could have been used on you. Small electrodes pushed and they about the size of the phone.
Could I?
Yes, please.
It says the goal is to retrain the brain to think there is no pain.
Yes.
So there is pain, but you're not perceiving it.
I'm just thinking how to
Like
properly
if a
start it.
tree falls in the forest, you know. it's
Pain,
there.
despite that we perceive that, and there's more and more research available every day on that topic. So pain is on itself, it's a different science. We think that the pain that we feel pain. What's happening with the body is pain is a response, not the sensation. In a way, it's not. So signal comes in like, imagine like most detailed is going to be 001110 or 00111 to the brain. Brain received that signal and it compares to every single previous experience. And he says like, okay, this is pain experience. I'm going to signal my host that, hey, do something about it. It threatens you, it hurts. That's why, for example, paper cut. Is it life-threatening? But it hurts.
Oh, yeah.
It doesn't hurt long, doesn't hurt forever, it heals fast, but it's very peripheral because there's a lot of nerve interpretation. So there's a lot of noise going to be happening if you cut something on your pinky or any of the fingers. So that's why brain receives it. Okay, too much noise. I want to calm it down. I'm going to call it pain. Stop it. Stop what you're doing. I don't want you to continue. So what's happening when another association, sometimes, especially over time, when we have something that hurts not just in a moment, but in days, and you working with the neuromuscular reeducation, meaning you introduce another signal or you introduce the motion that used to cause pain, not to have pain. For example, I teach the way how I can, or by holding or introducing a different signal for the scramble therapy during the therapy, and I reteach the brain, hey, you can actually walk and you're not gonna have the pain that you used to have. Brain records it and is like, oh, I actually can do it without pain. So maybe next time when I'm gonna have, and that signal not really is threatening for me. And then brain's like, okay, I'm not no longer having pain. You have to understand, if you have pain, it doesn't mean you injured right now. That's something that I'm frequently explaining to the patients. Like, I have on and off pain for the last 5 years in my back, as an example, but right now it's worse than ever. I probably lifted up something yesterday because I was cooking or standing, or I was moving my kids to college. Not really. The damage was done years back. It just your brain was able like to distinguish body would push through it. The damage is there, but those off times when it didn't hurt, something was different. No, your brain just didn't felt too much threatened by that, so it didn't send you a signal of pain. Also, you have to understand the severity of pain not always equal to the damage extended in your body. So paper cut may hurt really bad. And the nerve, caught nerve might not hurt at all. Because it's completely caught. But damage is there,
And severe.
but it's not hurting. So sometimes a lot of reports happening, people getting like fractures, shoulders, knees, legs, and they're able to walk for miles if they're in a high adrenaline sensation. Damage is there, but there's no response of the pain. Brain overoccupied different signals, taking care of other things, not able to fully assess it. And that's why you're able to win that stuff part of the time and get yourself into safe situation. That all goes into primary defense mechanisms in the body that were able to, us as a species, to keep us alive and evolutionize to this point. So pain is not always ouch, it's pain. Sometimes like you can have retrained certain experience in life, might be uncomfortable, but you retrain it and then become pleasurable. For example, soreness associations. If you're going in a gym or you do new activity, you might have like, okay, I did it like my bicep crunches or calf raises, and I did so many of them, and I'm in pain next day. But over time, I know it's good for me. I know it's helping me walk better. I like how it looks, and then, okay, next probably in a half a year, if I feel that soreness, oh, I feel stiff. I'm no longer associating with the pain, and I'm actually physically not feeling as much pain, even though I feel discomfort, but I'm more associating it like, oh, that's my development. I'm no longer focusing on the pain that it used to be a pain for me. But right now, I just label it differently, but also my body takes it differently. It's more like pleasurable versus aggravating experience. So pain, like consider like pain signals and brain, those signals has to be interpreted before they become pain. So that's why there's a scramble therapy comes in, and it's simply just put a lot more signals into it to override it. And that's how the brain can learn and it's like, oh, that's actually not pain. I don't have to be stressed about it. I can just skip. And that's when that activity gonna become pain-free. Different therapies, sometimes it's not everything is gonna be set in stone. If it becomes pain-free right now, doesn't mean it's gonna last for months. Or for example, another thing, like people became with a severe pain, they worked in PT for 2 weeks. Oh, my back doesn't hurt. I'm gonna do everything. I was like, don't run away. Like you still have a week 4. You still have the same problem you came with. It's not there, even though the pain went away. So all of that is like relative. Doesn't mean if you have pain, you don't have the problem. That's why the annual checkups is very important. It's not for nothing. You've been told like, hey, check with your doctors every year or every so and so, like every half a year if you're older, and make sure you have going through thorough evaluation. Right now, Medicare even recognizing that, and they want you to do like physical exam. You don't have to be in pain or problem. You just go to your annual physical with physical therapist, not just your primary care, to make sure, hey, is there anything I should do as a preventative mechanism versus wait until it's broken. Yeah. Spinal cord stimulation. So that's another device that's usually used with the severe conditions when the pain symptoms or disease does not respond to the medication. I have a number of people like that. It's placed next to spinal cord, connected to the nerves, and it's placed under the skin through the surgical procedures. They usually work for up to half a year, and like 3 out of 4 said like they were good for up to half a year. One said like up to a year, and then it's like diminished and pain override. So
Is that like epidural you're talking about?
no, epidural, that's an injection in the spinal cord, and that's it. They injection the medicine, it started to act, and what I'm talking about, the spinal cord stimulation, that's a small device about like this, like size of the pacemaker. So which is also about this size. It's embedded usually around the spinal like cord and the lower back. I haven't seen those for upper extremities, but usually it's done for the legs or lower spinal cord. From those that I see, the devices on one of the sides around here, and then electrodes either across to both nerves or just to one. So, and that's working constantly, and it just continues zapping at nerve to distract it from the pain.
Okay, so they have those put on for a certain amount of time and then they take them off? Or is that?
It's for years, it's like for a number of years. They
Is that
probably
inserted, or
opening
is that
it.
something you wear on the outside?
It's a minor surgery. No, it's you're not wearing it outside, it's under your skin.
Under your skin.
Does it eventually destroy your nerve?
It's not really into the way to destroy your nerve, it's in a way to stimulate. So like it's getting additional stimuli into the nerve so it can work. So plasma exchange, steroid, intravenous immune globulins, these treatments are often used to if inflammation or autoimmune conditions are causing neuropathy. With weakness, numbness, or imbalance, these therapies are not used to treat pain alone. So those are having a systemic effect. Steroids, intravenous immune globulins, plasma exchange. So that all basically stimulates your system, your immune system to recover and to get the nerves into better state, to make sure that if there's a pathogen in the blood or in the neural system that can be flushed out or fought better with the natural immune defense. Physical therapy. If you have muscle weakness or issues with balance, physical therapy can help improve your ability to move. You also may need need hand or foot braces, a cane, walker, or wheelchair. So that's something that we do. And I'm gonna give you more expanded response. So in our therapy, we always do the three components. We do manual part, we do modalities, and we do exercises. So one of the best way to stimulate your body, to engage your body into the movement. You have to walk better, you need to walk more. We find the way how you can do it safely. We find the way how we can stimulate the blood flow towards the area naturally versus steroid injections. That's a stimulation, so of aggravation to shut down all the inflammation and stimulate the recovery of the process of the system. We do it manually, we do it through the exercises. We put the load and stress on your muscles so they drive more blood. We introduce the motions into the joints so they can go through the range available and making sure that your body activating all the systems to start defending and repairing itself in the area that damaged. Frequently, what we have to work with, it's not just going to be the leg. If you come in with a leg problem, we have to engage your hips, we have to engage your core, because that's one of the mantras in PT. It's like proximal stability that's closer to your center, to distal mobility or farther. So wrist is distal, shoulder is proximal. So I need to have a stability in the shoulder so I can do everything what I need with my wrist. We work through that in a variety of different ways. We're trying to make sure we building a program that works for you and that you can tolerate, because what you can handle, you might not be able to handle. Or what Cheryl can handle, none of you can handle. Like, depends, like everybody on a different level. We might do the similar exercises, but they might have different ideas why you do them. So it's all different when you're working and doing your stuff. And then later on, like in the presentations, I'm gonna tell you more about specific case. We use the newbie from NeoFit machine. That's additional modality that we acquired at the end of the last year that actually targeted specifically into nerve stimulations and remodeling of the stimuli from the brain that nerves gain receiving. I'm gonna go more in detail, but for now, surgery, neuropathies can be caused by pressure on nerves, such as from tumor, might require surgery. So as I mentioned before, sometimes neuropathy can be as easily fixed as just removing a tumor or releasing a tendon that became stiff and started to create the compression on the nerve. Or sometimes they might go, depends where it's happening, around the spinal cord. If it's right at the root of the nerve, might need a spacer to create the release. So different medicine can be used as the pain modulations. Also, to improve the symptoms, improve the system, decrease the system. Pain relievers, medicine available without a prescription, such as anti-inflammatory drugs, can improve mild symptoms. So if it's only mild situation, that you can go to your pharmacy, talk to your pharmacist and saying, hey, I have this type of a pain, what can I use? And they might give you some topical analgesics such as Solarize or Voltaren, and it might decrease the pain in the area. Anti-seizure medications, that's for somebody who's more critical and more chronic. Medicines such as gabapentins that developed to treat epilepsy often improve nerve pain. Gabapentin is specifically good with the neurological condition because it helps to improve the exchange of the neuromodulators inside of the nerve tissue. So, but keep in mind, anything related to medicine in here, just to introduce you, it is there. I do not prescribe, it's beyond my scope of practice. That's going to be prescribed or dosed or told to you, hey, you need to take it or not to take it by your primary care physicians. So that's something that you discuss with them. Topical treatments, lidocaine cream available without prescriptions that are commonly used, sometimes also can be as patches. Antidepressants, so also somebody is more severe chronic pain like fibromyalgia or pains that are lasting like half a year or more, they need antidepressants. Antidepressants. So they are more specific into and how they work, even though you might not have a depression. They block your neuroreceptors. They block some pain neuroreceptors, and that's how they work with the neuropathies and peripheral neuropathies. But they're
Say antidepressants for fibromyalgia?
for pain, for severe pain.
Antidepressants.
Yes.
Antidepressants.
So it's more tougher cases. It's not gonna be used in a, hey, I have some pain and it's like there for a week, nobody gonna write you antidepressant, at least I hope so. Because all of them are having heavy toll to pay, basically they're hitting whole body. Everything has a side effect, you cannot just prescribe and take any medications and take it. It's all eventually gonna cost your body. So everything has to be.
Take that over to take it anymore.
So you just have to make sure that it's in moderation, so you have to express all your concerns to your physician or prescribing doctors to the extent. Because it has to be open conversations, you cannot just like, oh, you gave me 25 medications, I'm gonna take all of them. Hey, is there something I can take away? If you feel the medication, that's another common thing that happens frequently with my patients. People who are prescribed medications, hey, it's making me nauseous, it's making me drowsy, I cannot do this. Please refer to your physicians, even especially if it's right away in the second day or day when you're starting to take. I know it's hard to get hold of them, but still has to be addressed with them. You cannot just, oh, I decide not to take it. Sometimes there's consequences. My grandfather, he couldn't stop taking some of his medications, otherwise he would pass in 2 years sooner than he did. But certain medications, if it does give you side effects and you start feeling it, address it with your physicians. They might have other options. They might even negotiate with the insurance or so, or maybe you might negotiate with your insurance so you have more formulas that are better and easier for you to buy. Never hesitate to express your needs because you are the biggest advocate of your health. Nobody else interested in your well-being more than you are. And you are in the driver's seat. That's one of the parts also in our clinics, we're trying to get that information to you. We're trying to get it like, hey, maybe you should discuss this or that. Because we have a limited scope of practice, but we can recognize certain signs sooner than later. So we're gonna discuss today a peripheral neuropathy case. It's a small case study done in one of the clinics in Kansas. And basically, as I mentioned, newbie from NewFit, that's a device, it's a direct current device that we acquired last year. And that's one of the case studies that was done on the same machine that we use, but in a different location. With the case that peripheral neuropathy was chemo-induced, so the patient had a cancer and she was undergoing cancer treatment, and that well known with the radiation that you just started to experience very poor sensation in your extremities, meaning feet and hands. And particularly, they started to work with the newbie, since it's not contraindicated with the chemo, to improve her situations. It is important that clinician KJ had been seeing this patient for shoulder treatment. So a lot of things can be done when there's a good protocol between the therapist and the patient. So when you openly can discuss your concerns to your therapist, that's very important, and that's what you recognize. That's why they also, even in their case studies, they made a separate paragraph to make sure that they patients was in line and on board with the therapist plan to address the disease. Sometimes if people don't feel comfortable, and it's frequently happening with the pelvic floor therapist, especially if you have a male-female therapist. We have, by the way, a female therapist who specializes in the pelvic floor and Riverdale locations, 2735. So if anybody experiences problems, you may address that issue. Yep, sorry. Have to get my loud voice again. I stopped at the position that people have to have a good protocol with their physicians or therapists so they can express all their needs. So even for the case study, they emphasize that there was a trust, there was an understanding of what's the therapy done and what's the procedure is done for. So they started using Newbie on both legs. Feet immediately improved with the neuropathy, like meaning the symptoms decreased and the pain wasn't so much. In just 2 months Newbie treatments, the patient now has about 100% feeling in both hands and feet, has been able to remain on his current chemotherapy drugs. So that's very important. Well, if you're undergoing any major therapies, your other symptoms may prevail. So if you brought up it to the therapist, your program can be modulated to combine your current treatment, medical treatment, plus physical therapy, and work with your physical balance and other things. So this is the Newbie machine. This is one of the setup that's done for peripheral neuropathy for the hands. That also same setup, but instead of the hands, it's going to be a foot going to be set up. That's done in a way to stimulate the peripheral nerves to amplify the site. So how you can stimulate anything in the body? Usually the same way. If you want your muscle grow, you're using those muscles more. If you want to have more strength in running, you're running more. So when we're using this machine for the nerve stimulation, we use it to send the signal through the same nerve pathways. Newbie is a direct current, so it's a very strong but very close to what your brain-like signal would be sent down the nerve. So you're using the nerve more to stimulate its recovery. You're stimulating your body to send resources to the nerve and keep it healthy, keep it sound. So that's what the machine does. That's not only for the peripheral neuropathy, we also do it for the vagus stimulations. If somebody has a very high anxiety, somebody cannot sleep at night, and they have troubles with that, we all do that to stimulate more calmer response in the body. I have people, like I actually have one person, she has a late cancer stage, and she has a very tough time. She used to have a very tough time to sleep through the night. She couldn't sleep more than 3 hours in a row because the severe pain would start in the body, everything. When we started vagus therapy, she's able to sleep 7-8 hours almost every night. It's not ideally every night, but then most of the nights she sleeps, and you need sleep to recover. If you don't have a deep sleep, that's a big problem. You cannot recover, you cannot build up your strength. And that's about it.
Is that Newbie machine you're talking about something like the TENS?
It's like the TENS, but I am looking for the analogy. It's
Like
not,
a
it's a
distance or something.
different current. It's completely different current. So for example, TENS would be battery, Newbie would be electric station. It's like different sizes and different type of work. Plus, as I said, it's not just populate the signals to the nerve, it has a very specific signal that triggers the nerves and can trigger deeper in the body than any TENS would do because of the type of the current. Plus, usually that direct current would be very prone to burn the skin, especially with the applications. This one has a pulse direct current, so it's not really causing burns on the skin.
Okay, so does that have some kind of a, I've gone to therapy and they'll put a machine on and they'll say, let me know how much to
That
stop.
would be regular TENS.
Ah, okay.
That one's similar because we're gonna put, for example, even as you saw in the picture before. You see the pad, I'm sure you're familiar with those pads, the different current, but it's in the water. So we would say, hey, we
Oh,
want
that's in
not
water?
just like uncomfortable, yes.
In
you
what,
see?
with electricity?
Yeah. That's like in the medium, because you need to activate all the nerve endings. I cannot have 1,000 small pads here, so that's why you submerge it.
So the
You
only
have
thing
one
is the
end
hand.
here, another one end here.
Okay.
So it's basically little electrocution. Don't experiment with
Okay,
this
okay,
one
okay,
at home.
yeah,
Um,
it's a little dangerous.
So what do you feel when you go,
Uh,
somebody like that? What they-
zapping, like a lot of zapping is like sometimes it might clench the hand. It depends how much you're tolerating. We bring it up to the tolerance. It's usually higher. The tens, tell me when you're comfortable. Here, tell me when you're about 6 out of 10. 0 is nothing, 10 is like blood everywhere, bones on the ceiling.
Oh,
So it's
yeah.
basically worst pain you can imagine.
Yeah,
And we
but-
bring you to 5, 6 out of it. It's all to your scale, because my 5 will be different than yours.
So when would you have it for the hand, if you put the hand?
This
here?
is a peripheral neuropathy in the hand. And same thing can be done in a leg. I just couldn't find the picture with the leg.
Okay.
Yes, please.
How long has this machine been around or used?
Uh, definitely more than 5 years.
And the really important question, how does insurance and or Medicare?
Medicare,
Right
we're
there.
billing it under neuromuscular reeducation. So we do not get any perk, even though the machine is very expensive, we do not recoup it through the things, through the actual, for example, laser, it could be as a separate therapy. We decided not to do it. We said like satisfaction of the clients is basically our goal to success. So we just fit it into the treatment. So if you have a Medicare or any major insurance, you don't worry about, hey,
Blue
do you
Cross
cover
is the
this
same
machine?
thing.
Doesn't matter.
Had another question, but I forgot it to go to somebody else.
No worries. Yes.
How would you treat a chronic both legs, like half?
So,
Muscles
and
and
that,
get
one of
involved.
the first questions that I would ask, did you do your full blood analysis? So you need to have your blood checked, make sure you have a proper saturations of calcium, potassium, all of that. And because sometimes insufficiency in the calcium, potassium is gonna be, or sodium, will cause muscle cramps, especially those that happen in the evening. Then I will make sure that you have a good sufficient hydration. And then also we'll make sure that you have a good strength and stretch in your muscles. Because kappa is frequently like weakness, insufficient of hydration, and missing of the potassium, that would be one of the things for muscle cramps. So it's treatable, it takes a little bit of time, but also we're trying to do the all-round check. Did you remember it?
Yes. So this is for nerve stimulation, but if you have like a pinched nerve or something, does it calm it at all, or it's the opposite?
All depends on the case. It wouldn't re-aggravate it, but sometimes pinch nerve, how pinch, where pinch? Give me an approximate scenario.
Neck,
Yeah,
shoulder.
so in that case, if it's just a pinch, that may help to work for the muscle. That particularly, there's multiple applications how we do it, like it's gonna be scanning and finding out which muscles are weakest, and we will target those. And then for the decreasing the pinch on the nerve, we would work manually to create a space for the nerve by stretching and mobilizing the spine.
With this or with physical? therapy?
It's a combination, consider it's one, it's a part of the physical therapy, it's one of the
But
modalities.
this would calm the muscles and stuff that's squeezing the nerve?
It would trigger, it would stimulate those that are super weak, because usually if there's pinching something, there's gonna be disbalance. Squeezing on one side, weakening on the other side. So how you working it, you're balancing out, you're trying to relax the stiff part and tighten up the weaker part. That's what you do to stabilize. So we might use it, might not, depends. In this case, when we're talking about the neck, if it's appropriate, because you cannot, even though it's a good, I'm not gonna use it on everybody because it's good. I wanna make sure I'm using it when I need it to get the result that I need. We have other modulations and technique to apply in certain cases. So that might be used to actually stimulate those weaker muscles. Because especially if it's for a long time, chronic, we call it more than 3 months and considered to be chronic. This machine helps to override that compensation, because the pinch is actually could be as a result of the muscle compensation on opposite side. Any other questions?
Oh, yeah, another one.
Please.
Different body part. She was talking about the calves,
Yes.
and I've had this on and off every so often if I do stretches.
Mhm.
My left leg is fine, my right leg, the calf will go into spasm, and I literally have to do this until the muscle
So
calms
that's
down.
more, that partial peripheral neuropathy in a way that there's
Is-
something triggers the nerve, so we have to look up the chain, like more hip and lower back. To find out what's triggering, because calf in this case, it's more a symptom, it's not the cause. So we need to find what specific happening there and why it's caused by stretch, either just because it's a super weak and we just need to build it up. Or there's some impingement happening when you're stretching or moving around that triggers that response.
But how would you trace that? Because, I mean, x-rays don't show that.
X-ray
An
shows
MRI
only
tracing?
bones.
Yeah.
Manually, you can reproduce it manually. You can reproduce it manually. You show me what motion causes. I'm saying, hey, do alternate this. Do you have the same response? And based on your body positions, you can judge it like, hey, here I'm narrowing this side of the spine, so I'm gonna have a less space for the nerves, and I'm stretching it, and I'm getting a spasm right away. Versus I'm gonna open you up on the opposite side, and you're gonna do the same stretch, and you don't have that cause. So then my conclusion is gonna be, hey, build up your lower back. Show me what you have, what researchers you already done on your lower back, and I will tell you what you need to do. It's pretty straightforward. It's not that I cannot do anything because I did not see the MRI or X-ray. There's a lot of manual techniques can indicate it. What's wrong with the body. Right now is actually PT is being placed in the ER. Some states in New York, mainly in Canada, they already started a big pilot program. They're putting in PT to assess the person that came in into emergency room to determine if there's an X-ray or MRI needed or not. Because things like MRI, unless you do the surgery, it doesn't really render too much. A lot of things you can retest and predict. I know what results my patients will get when they go to MRI. If I work with them like for a number of times. It's only like, oh, okay, there's a more severe compression that I estimated. That's why it's taking so long, not responding to the therapy. Because sometimes if you're working with a person and you don't get the response that you know, hey, by this time we should be somewhere there. I should have seen this response, and it's not really like that. I'm standing, hey, go to your physician, get your MRI done. It's a straightforward. We're not fooling anybody. We're just honestly telling, hey, you're doing a good job. You're improving. You can see it. Good job. Hey, we're not improving. There's something else. Let us take a spin. Let's look from another side. Let my colleague look at you. Let's probably do the MRI. Let's do something like that. It's straightforward. How it is. You had a
Can you
question?
describe a pinch nerve? I don't know. I really don't understand.
Pinch nerve. So for example, temporary pinch that may be positional. It could be, for example, you're sitting on one side and your head is tilted and your hand become numb. So you got occlusion of the nerve temporary, and it's like it fall asleep, not working, you can't use it, you opened up, you shaking it up, you started to work.
That's
Or,
very-
for example, pinch nerve in the back, every time I'm stand up, I'm having a sharp pain throughout the leg, like almost buckling, then I'm able to recover and more or less recover. So that like more pinching is more like episodical, like happening. Longer time it would be already called compression, like chronic compression. That means like one side is weaker than another side. I might not feel the sharp pain, I might not feel the pain at all, but I'm just super weak. Or for example, one of my patients, big guy, bigger than I am, strong, everything. He's lifting the hand becoming shaking over here. Up to here, everything is good. His normal life, everything. Lifting here, the hand's starting to shake. It is like nerve becoming stretched and pinched.
But would that be without pain or with pain?
Sometimes with pain, sometimes without. In this particular case that I described about the guy, he does not have severe pain. It's mild.
What, my sister suffers a lot from, she'll be asleep and she'll stretch her leg out and she'll get these cramps and her calves.
Same thing, could be hydrations, could be ions insufficiency in the blood, could be weakness. Most likely at least two out of three. Together. Any other questions? Yes, please.
Okay, I'm off on the side.
No worries.
In the past, I've had, oh God, acupuncture,
Yes,
and she put like a stimulator on the end of
Yes.
that. Is that similar to this or totally different?
it's similar in a way that you use current.
Well, yeah.
So like, I'm just trying to give you a detailed answer. But then,
that works on
with the
muscles
rest,
and she
no.
works
So
on-
the way how acupuncture works is a little bit different, philosophy, because I use acupressure. I'm not using a needle. New York does not let me use the needle. So I use acupressure in practice and, in acupuncture, you're using bioactive areas that reflex, go triggers other body parts. So you
Right.
put the needles in there to activate it, and electricity makes it more potent versus just a needle. With this, you're not going this, you do separate scanning. So not in this example, but for example, in muscle weakness. So for example, I might have muscle weakness here. So I'm putting one electrode on my lower back, one electrode here. I'm finding the most weaker spot. And then I'm stimulating, and this is gonna be corresponding with the least muscle electric resistance in this area. So that means this muscle is the least responsive to my brain impulse when I'm trying to use my wrist. So then I'm using that machine, bracing that muscle. I'm gonna have one electrode here, one right over the least resistant spot, and I'm gonna stimulate the heck out of it to stimulate it to work. And that's how I educate my body. When you hear the signal from the brain into this area, you need to resist, like lift as much as you can. And that's how you bring it up with your muscles to work. It's basically like an old car crank start. Any other questions, please?
I think we're just finishing up, so one
Okay, I
more
have one
question if,
What can you, do for somebody that has, hernia disc on their neck? And that she's already had, trigger point, she's had, epidural, but the discs are herniated and she can't have it operated.
A lot. We can do a lot. Depends on the
For the pain,
severity. I
for the
cannot
pain.
promise anything. For pain, definitely. For strength is a lot. If anything, I have two protrusions and one herniations in the neck only. Lower back as well, I have a bunch of.
Okay,
So,
but,
but then if you properly load it, it's have to be very gentle and slow in the beginning. So we're talking about what can be done for the person with the herniations in the neck that underwent steroid shots but cannot do the surgery. A lot. There's some complicated cases that works, and there's some easier cases that can be resolved with the PT very easy and successful.
I used to hurt, I used to, relieve the pain a little bit.
Yes, definitely. Like majority of the cases, yes, it takes time. It's not gonna be like a straightforward boom, you're feeling great. But if the person willing to put the work, definitely change can be
Okay, do
done.
you need a referral to go to you or?
To start, you don't need the referral unless you certain Fidelis or so cards. You can take the flyer, call, hey, I have this insurance. When can I start? The front desk is trained. They're gonna let you know what you can start, if you need the referral on the beginning or not. Usually when you call us, you're gonna speak either to Audrey or Nicole. They're gonna take your insurance information. They're gonna run the eligibility. They're gonna tell you, hey, this is your deductible, this is your copay, this is, you need a prescription, or you can start without the prescription. And you're gonna be notified. If you're not notified about the payment, it means you're not responsible for it. We don't back charge.
Okay, you're on Riverdale where?
2735 Henry Hudson. It's professional building across the highway.
By that white tower or whatever?
Whitehall is 2
Whitehall.
blocks away.
any free parking?
No, sorry. challenging.
Hey, it's the Bronx.
If it makes you feel better, the parking around here on the worst day, way better than on a good day in Brooklyn. Parking is-
Oh, Manhattan, forget about Manhattan.
well, it's like, Manhattan is kind of in between.
Yeah.
Or you can come to 2600, so 121 location right here in this building. It's a little bit smaller, but that's all.
I think we're good. I think that's.
Thank you very much. Thank you for your time.
Coming, yeah, thank you.
Thank you.
Thank you for, good.
Thank you. I enjoyed it.
All right. All right, bye, Rainey.
Bye.